Like do a fake one here. So C-section scars will be quite small. So usually, again, you're waiting until at least 6 weeks before you're manipulating like onto the scar tissue. Usually what we'll do is like starting with just like some sensation checks and just seeing like where they can feel. Is it a normal sensation? Is it exaggerated? Things like that. Is there any pain kind of like along with that pressure? And then usually people are pretty uncomfortable with the area being touched. So usually I'll start with like kind of looking around or just seeing the connective tissue and if there's any like restriction. It's usually on this left side. If the surgeon is right-handed, they will often like finish off on this like right side and like bunch all this tissue together. So it tends to be tighter on one side of the scar. And that is usually the side that the surgeon like closed off the stitching. So then like if this side's like, ooh, it moves nicely, this one will be like more restricted. So they'll have a more tender side. So kind of just checking for any of that type of thing, just seeing how it's moving. Again, like scar tissue is just like the angles are all different. So you're just really just going in all different directions and seeing if you're finding any spots where it's like just restricted. So then if you're after the 6-week mark and they're comfortable with you touching it, you can start kind of like just generally like a general assessment of like, is there any points where there's some restriction, and just checking for any of that. Usually it's on the edges, again, one more than the other. And then for working through actual restrictions and releasing them, those restrictions, you can start with like pinning it on one side and then doing some like lateral pulls and kind of doing that the other way. You can work through like pulling it like up or pulling it down or like any kind of directions there. Okay. And like just sort of teaching them this too and saying there's no wrong way to do this. If you just sort of like play around with the scar, that can be really helpful. So this is all sort of downward pressure things that I really like because the scar is so deep and there's so many layers of it. I really like to make sure that we can get into some like scar lifts and trying to get into some of those deeper layers. So usually what will happen in this area is it won't lift nicely like this. You'll get almost like, instead of the lift like that, it'll be like that, where like the scar tissue is just pulling it down in that center and it almost like fall out of your hands. Like it just won't really lift up. So then you'll just try to like maybe get in there and just sort of working through, this like whole area and just trying to get some of those deeper layers moving. It can feel weird. It's usually just like a gentle like pulling and stuff. I'm usually not like too aggressive with it. And then usually they're fine. If anything, they have like so much altered sensation there. They're like, it feels weird, but I can't really say if it's hurting or not. Sometimes it can be a bit stingy and painful in the spots that are really tight. That spot's a bit tighter for you. And then so you're just trying to get those scar lifts, and then if you can get it, and then you're trying to like lift it up. So you're pulling some of those deeper layers.